Hello everyone. Today, I would like to introduce the OneCAS KIT. The OneCAS KIT combines the CAS KIT, which is designed for crestal approach sinus surgery, with the digital guide system OneGuide. As a result, it provides a more accurate, safer, and more convenient workflow for maxillary sinus procedures. The first benefit is precise drilling and accurate implant placement in the maxillary sinus. During sinus surgery, the bone surface is often uneven after flap elevation. Even if the residual bone height has been carefully evaluated through panoramic images or CT scans, it can still be difficult to accurately determine the drilling position and depth during the actual procedure. In conventional CAS KIT procedures, the stopper may seat on an inclined bone surface, which can cause instability in the drilling path or inaccurate depth control. As a result, the implant placement path may deviate from the planned position. In contrast, the OneCAS KIT procedure is performed with the OneGuide template in place. This allows the stopper to seat on a flat surgical guide surface, enabling more stable depth control throughout the drilling sequence. As a result, clinicians can achieve more accurate path control and place the implant closer to the originally planned position and angulation. As shown below, digital planning is first performed using OneGuide, followed by safe sinus surgery with the OneCAS KIT, ultimately enabling implant placement at the planned position. The second benefit is safe sinus elevation with a reduced risk of membrane perforation. As you can see, the OneCAS Drill features a rounded tip design that helps minimize the risk of membrane damage. In addition, the cutting edges are designed to face inward. This structure allows a conical bone lid to form during drilling at the sinus floor. As a result, the rounded drill tip and conical bone lid formation help provide safer sinus floor penetration during the procedure. The third benefit is a convenient membrane elevation and bone grafting procedure. The OneCAS KIT includes dedicated tools for hydraulic membrane elevation and bone grafting, allowing clinicians to perform the procedure more conveniently. The hydraulic elevation tools are designed with a mushroom-shaped wing structure that provides excellent sealing capability. This helps minimize saline leakage during hydraulic elevation. In addition, dedicated bone grafting tools such as the bone carrier and bone condenser are included, allowing faster and more convenient graft delivery. The bone carrier features a funnel-shaped design that helps reduce graft material displacement during graft placement. As a result, clinicians can achieve wider and more sufficient membrane elevation, followed by convenient bone grafting and more symmetrical, symmetulical, bone formation. In addition, both tools are designed to fit the OneGuide template hole, allowing more stable and convenient handling during the procedure. This enables clinicians to perform the entire workflow continuously with the guide in position, from drilling and hydraulic elevation to bone grafting and final implant placement. Next, let's look at the OneCAS KIT components. The upper tray includes depth gauges in both regular and wide specifications. The main tray includes the flattening drill, twist drill, and OneCAS drill in both regular and wide specifications, along with stoppers and hydraulic elevation tools including the hydraulic membrane lifter. The lower tray contains bone grafting tools such as the bone carrier, bone condenser, and the connecting tube. Overall, the kit includes most of the essential tools required for sinus surgery. However, the tissue punch and implant placement tools are not included in the kit. Therefore, clinicians should prepare the OneGuide kit separately or place additional tools in the spare space within the tray. Finally, let's review the OneCAS KIT surgical protocol. The chart below shows the recommended OneCAS drill diameter according to implant diameter and bone quality. For example, when placing a 04.5 implant in soft bone, the initial drill and 02.8 drill are used first, followed by the 03.31 CAS drill as the final drill. As shown in the surgical sequence, the procedure begins with a tissue punch, followed by the flattening drill. The drill expansion phase then begins with the initial drill, followed by the 02.81 CAS drill. For example, in a case with 6 mm residual bone height using a 7 mm OneCAS drill, drilling begins at a depth 1 mm shorter than the residual bone height. This is achieved by applying a 2 mm stopper to the 7 mm drill, resulting in an actual drilling depth of 5 mm. When switching to the 03.31 CAS drill, the same 2 mm stopper is used to maintain the 5 mm drilling depth. After that, the drilling depth is increased incrementally in 1 mm steps. For example, replacing the 2 mm stopper with a 1 mm stopper increases the actual drilling depth to 6 mm. At each step, the depth gauge is used to confirm sinus floor penetration. If penetration has not yet occurred, the drilling depth is increased sequentially by another 1 mm. This step-by-step approach allows safer sinus floor penetration while maintaining controlled depth progression. Once sinus floor penetration is confirmed, hydraulic elevation and bone grafting are performed sequentially, followed by final implant placement. In conclusion, the OneCAS kit provides a more predictable sinus surgery workflow through accurate path control and stable depth control based on a digital guide system. In addition, the entire procedure can be performed continuously with the guide in position, from drilling and hydraulic elevation to bone grafting and implant placement, improving both procedural convenience and surgical stability. Thank you for your attention.